Now, with all this power comes responsibility, right? Let's talk ethics and evaluation.
Absolutely critical. Our source defines AI ethics in healthcare as the principles ensuring these tools are developed and used responsibly. Think fairness, transparency, privacy, accountability. These are key. And closely related is model evaluation, systematically checking AI models for performance, reliability, and potential biases. In healthcare, this has to go beyond just technical accuracy. It includes things like clinical validity and even user satisfaction.
And the source highlights that ethics and evaluation aren't separate things. They influence each other, right? Ethics guides how we evaluate, and the evaluation results inform ethical decisions. It mentions a study looking at service experiences, S and medical quality MQ assessments, revealing potential trade-offs.
Exactly. It's a two-way street. You need ethical principles to decide what you should measure in your evaluation, like fairness across different groups. And the results of that evaluation tell you if you're meeting those ethical standards or if adjustments are needed. The SEMQ study is a good example. Sometimes improving technical performance might impact user experience or vice versa, and you need to evaluate both to make ethical decisions about deployment.
Let's look at some specific examples of these challenges from the sources. Balancing performance, for instance. We talked about prompt engineering improving accuracy, maybe from 80% up to nearly 100%.
Right, but the source might also imply, or other studies show, that getting that super high accuracy with complex prompts could potentially make the AI respond slower, which might affect user satisfaction, especially for busy clinicians. So there's a trade-off to evaluate.
Makes sense. Another big one is fairness in diagnostics. AI tools need to work equally well for everyone, right? Including underrepresented groups.
Absolutely crucial. An AI trained primarily on data from one demographic might perform poorly or even make harmful errors when used with patients from other demographics. So evaluation must check for fairness across different populations.
Privacy is obviously huge in healthcare. The source mentions techniques like federated learning and differential privacy.
Yes, these are methods designed to train AI models on sensitive patient data without exposing the raw individual data itself, helping to protect privacy while still allowing the AI to learn.
And transparent clinical decisions support the black box problem we mentioned earlier. It's important that doctors can understand why an AI is suggesting something, isn't it?
Hugely important for trust and safe use. This is where explainable AI, XAI, comes in techniques aimed at making the AI's reasoning more understandable to humans.
So evaluating these systems isn't just about checking if they get the right answer technically. Our source contrasts different evaluation approaches, technical, ethical, and comprehensive.
Right. Technical evaluation focuses on metrics like accuracy, speed, etc., developer-focused. Ethical evaluation looks at fairness, bias, transparency, privacy focused on patients, providers, society. Comprehensive assessment tries to bring it all together, balancing technical performance with ethical considerations and real-world impact, involving all stakeholders throughout the AI's lifecycle.
It sounds like a much more holistic way to think about whether an AI tool is truly ready and appropriate for healthcare.
It has to be. Given the stakes, we need that comprehensive view.
Well, we've covered a tremendous amount of ground in this deep dive: the AI hierarchy, generative AI's potential, the spectrum of conversational AI, the power of automation and agentic workflows, and critically, the ethical compass and evaluation needed. It's clear these technologies are moving fast and really starting to reshape healthcare.